treatment and outcomes of sheltered cats with Panleuk using the canine parvovirus monoclonal antibody. And so as it seems to be more graceful to have our speaker introduce themselves because they know them better, I will hand it over to Dr. Fuller. I just want to mention too, if you have questions, we'll gather them and answer them at the end. And if you want to pop them in the chat, I will just keep an eye on that. So take it away, Dr. Fuller. Thank you.
Hi, everyone. I am Lucy Fuller, and I'm excited to be here to talk about this CPMA and cats. And this is something I get questions about a lot, especially since I decided to present at ABVP. So I'm really happy to talk about it and answer all your questions, I hope. I am at the Charleston Animal Society in Charleston, South Carolina. And so I'm on the East Coast, sort of hot weather. We get lots of cats, lots of Panleuk. So this is sort of top of mind for us. I've been there since I graduated from vet school, which is an increasingly long time ago these days. Graduated in 2008 from the University of Georgia and went straight into shelter medicine and stayed, love it. I did a shelter certificate with University of Florida in about 2013 and currently slogging through trying to become boarded if I can ever make it there. So yeah, it's a great place to work. It's a great shelter medicine's just been lovely, and excited to share this with you guys today. All right, so let's talk. This will work. Sorry, I'm trying to get it to advance. Nope. Hold on. Y'all don't see it advancing, do you?
No, not at this stage.
What? So let me see if I can get it to work. Sorry, guys. It's okay. It works fine when I'm not sharing. All right, let's try it again. Okay, I don't know what's going on, but there we go. Is that better? Hopefully everyone's seeing the advancing slides.
Yep, that looks great.
Okay, all right, great. So the Charleston Animal Society is an open admission shelter. We are privately funded, well, partially privately funded. We do have a contract at this stage with a number of municipalities. And we took in about 9,877, maybe exactly, dogs and cats in 2024. So medium-sized shelter. We've been treating panleukopenia for about 5 years or so. We treated parvo for a lot longer, but before that, just the sheer number of cats meant that a panleukopenia diagnosis was often not one that we could handle, so we would euthanize. We do vaccinate all cats and kittens of all ages. So we started vaccinating even very small neonates recently at intake with a modified live vaccine. Well, we do ask our staff to use PPE when handling new intakes. Anything sick in-house and young animals, like our ICU area has a lot of young animals. So we're wearing gowns and gloves, sometimes shoe covers with really the more serious diseases like Panleuk. So we diagnose panleukopenia the way most people do, generally by a DVM or an LVT, based on clinical signs and a positive parvo snap. So we're using the IDEX parvo snaps, although certainly there can be a suspicion, even if the snap is not positive. And so many times we'll be treating an animal as if it had parvo and using all of the preventative PPE and everything, and all of the same treatments aside from CPMA, even if we don't get a positive snap. And I'm sure that's pretty similar in many places. So our treatment is pretty standard and supportive. Fluids, antibiotics, pain medications, gastroprotectants, diarrhea treatment, because of course, many of these kittens have pretty significant diarrhea, antiparasiticides. We did add CPMA to our standard treatment protocol for dogs in the beginning of 2024. It just happened to be January. And then about mid-year in 2024, we added CPMA to our standard protocol for cats. So we do give the CPMA subcutaneously, and it's the same dose as dogs. So it's very similar. And really, we just kind of We had a good number of Panleuk cases, and I'll talk about that in a minute. And I just sort of said, hey, let's try it, because that's how I do a lot of things. I did have some, some folks I know who were talking about it a little bit. Oh, I've heard that so-and-so is doing this. And, so it wasn't just completely out of the blue. But really, we just kind of decided to give it a whirl. There definitely is support in the literature for this. So these are a couple of published articles out there. The first talks about using a parvo fragment that could be a prophylactic or therapeutic agent for diseases caused by the Panleukopenia virus, so that cross protectivity there. And then the second article talks about IgG supplementation via the serum injection that is substituted for colostrum. So both of those are supportive of the theory that it could be helpful in cats. Also, I'll try almost everything once. So that's really probably the main reason. So we're kind of investigating our Panleukopenia cases, and I just had that feeling that we had a lot of Panleukopenia. It seemed like more than previous years. I felt like they were telling me every other day we had a new Panleuk case. And, I just got that kind of hair on the back of your neck standing up feeling. I was concerned we were transmitting it in-house, because every year, our intake numbers were not really significantly different than the previous year, but the Panleukopenia numbers were higher. So of course I was concerned that it was being transmitted in-house. So we adopted CPMA mid-year in hopes of improving outcomes and decreasing treatment days, because we had significant capacity concerns because of the number of kittens. We had some data once I started looking at it that indicated in-house transmission. So the time in care prior to the diagnosis of the disease was the thing that concerned me the most, because certainly I expect for cats and kittens to be exposed to Panleukopenia outside of the shelter. But I hope that they are not exposed inside of the shelter. But if they've been in care for 2 months and they're not going outside again, it's probably in the sheltering system somewhere. So here's some data. We ended up with two groups very organically since we started using CPMA mid-year. And this is just year-on-year data. So 2023, we treated 20 kittens, and we had 94% survive. Although it says kittens, it should say cats, because some were kind of on the older side. Average age, 8.4. So there were definitely a few adults in there. And that was 2023. In 2024, we had 55 kittens and cats that we treated, an 85 to 86% survival rate. We did analyze the treatment days in the 2 naturally created groups, and we had 8 days of average treatment time for our non-CPMA groups. That ended up being January to July, and then July through the end of the year. The average treatment days for that group was 5. And the average age of the treated cats in 2024 was quite a bit younger, so 2 months. So this is some of the data that really is less CPMA specific, but I was just interested in. So the time in care prior to diagnosis, we definitely were seeing some differences there. We separated it out by just all animals and then live outcomes. And a couple of these numbers are probably skewed by litters of cats. But what we discovered, for those interested, is that we were probably transmitting Panleukopenia in our foster exam clinic on our scale. That they were not cleaning the scale properly between litters. And you could actually look at the date they visited the shelter, and they were being diagnosed anywhere from 3 to 7 days after coming in. So we fixed that, and things changed pretty quickly, which was great. So this is the more CPMA specific data here. The median time from diagnosis of the disease until clinical resolution or death was where we saw a significant difference that really indicated that maybe CPMA was helpful in decreasing treatment days. And we then separated it to those kittens who survived. It's even more significant. So slightly more significant. We did not see a change or a decrease in mortality using CPMA. And that's something that we've heard from some other folks who've looked at data as well, that really mortality is not affected, but treatment days seem to be the most affected. So again, really the difference that we saw that was significant was the time from the diagnosis of the disease until clinical resolution or death. So the time that we're hospitalizing that patient generally, which is really the most expensive thing that we do. And so we did definitely see a significant difference between the CPMA and the non-CPMA group. So using CPMA decreased the number of treatment days by about 3. So we haven't seen anything that we've recognized negative outcomes. We haven't had reactions of any sort that we've noted. It didn't really affect mortality. So animals that were going to die apparently will still do that even with CPMA. But it decreased those treatment days by about 3. And I was really interested, of course, in what affected mortality most. And it seemed to be, at least in 2024, that the age of the patient affected mortality most. So we had a number of kittens in the 4-week-old age group, and there were a couple of litters that kind of skewed things, but those were much more likely to die. And I have some of that data graphed out right here. So the 2 groups, 4-week-old age group and 8-week-old age group, were the most represented just in general, which is not surprising. But the 4-week-old age group was significantly more likely to die here than the 8-week-old age group, or certainly than older than 8 weeks. So the next thing, I hear from a lot of people is, how do you justify the cost of CPMA? And for our organization, who's already treating Panleuk, the biggest cost we have is really that hospitalized time, because the labor cost is significant for my LVTs and my other, shelter technicians to provide the hospitalized care really is expensive. So it costs us about $100 a day. We have made an estimate there. So if we're just looking at care days, without CPMA, if we're looking at an average of 8 care days of treatment, that's $800 per animal. And if we use CPMA, then it drops to $500. So certainly there's a cost associated with CPMA. But if you are looking holistically at the entire treatment, you might realize cost savings by spending a bit more upfront. We do treat multiple kittens with 1 vial. And so 1 vial treats about 11 pounds or so. And certainly most of these kittens are less than that. They're pretty small. They're like a pound. So you can treat an entire litter with 1 vial. And I did recently confirm with our LVT that we are refreezing it. It's definitely not recommended by Elanco, but it at least doesn't cause problems. We're refreezing it if we're not using the whole bottle for kittens. And for dogs, generally they get a whole vial, so they're getting a new one because they tend to be at least 11 pounds. But for kittens, we're kind of reusing that vial. This is one of the kittens we treated. It's a quick case overview, so you maybe can get an idea of how we approach these. So Emmett came in as an 8-week-old kitten with multiple siblings and related cats. It was a sort of a hoarding situation. He and his litter mates were underweight. They had severe fecal scald, and there were about 8 total Panleuk positive kittens from the property. 1 litter of 8-week-old kittens and 1 litter of 4-week-old kittens. They were all parvo snap positive on intake. So these are just our notes. And we have so this first line says patient moved with siblings to HH, which is called Harvey House. It's a isolation area that we created. And they did have clinical signs, underweight, dehydrated. So we use Cerenia, ondansetron, CPMA, Convenia for the antibiotic coverage, and then some sub-Q fluids. These kittens were eating, which was great news. And we continued full treatment with the same medications. We use a GI diet generally, topical treatment for fecal scalding, and just monitoring, daily monitoring. So often we'll put these kittens, especially if they need it, on IV fluids if they're not eating. These luckily did not need that because there were many of them. But the treatment for this particular litter took 10 days. They were really severely affected. And then another 9 days after that to resolve diarrhea. They were difficult cases, but they did eventually resolve. Interestingly, this group of cats, the 4-week-old kittens, we had multiple die. And I think it was really just general condition on arrival that affected that the most. They were all quite underweight and had been infected for quite a while. There's some references from this particular presentation. And then I want to entertain questions. They're out there. Let's see.
None in the chat so far, but Lucy, I do have one question.
Yeah.
What is your clearance protocol for moving them through? Like, did this change that?
You know, it's a good question. I typically and I recognize that a single parvo snap is not the best indicator of clearance, but we do still use, we retest our dogs and cats. And if we can get a negative, that'll kind of help us make our decision. But usually clinical resolution, the patient should be eating, the patient's diarrhea hopefully is resolving, although that's not always the case. And we know that it's normal for diarrhea to continue, but generally if they're eating and not vomiting, and they are no longer, they're not dependent on IV fluids or anything like that, then we will consider them mostly resolved. We do parvo snap them again, see if we can get them negative. There is some indication that the use of CPMA can decrease shedding of both the parvovirus and a panleukopenia. And so I don't know that I can appreciate that clinically. Like I know it, I've heard it and I hope that it's true because certainly we don't want it shedding in the shelter, but they're supposed to get a bath before they move back to population. But we do continue with cage signage that indicates that they were panleukopenia treated or parvo treated so that staff will continue to wear PPE because of the potential for shedding. So ideally, if, I got my way, once they're clinically resolved, they would go to foster care for about a week, and then they would return. I like a CBC if they were severely affected before we do surgery or something like that, because I feel like, we're expecting significant changes to the CBC because of the virus. So I like to see that if we can get, in some of these kittens cases, enough blood to do that. But yeah.
Okay. Another question came from Dr. Jacobson. Maybe if you could speak a little bit more to how you freeze and thaw the CPMA.
Well, we don't have a very specific scientific protocol. Maybe Dr. Jacobs can come up with one because I know she would do a wonderful job. We literally just take it out of the freezer and it usually defrosts pretty quickly. I think within a few minutes because it's not a very big vial. And then they pull up their doses and then stick the bottle back in the freezer. So it's in a standard freezer. It comes sort of deep frozen, I think. It comes on dry ice. But then they tell you, put it right in the freezer and, don't pass go, basically don't leave it out. So certainly if it were defrosted and then left on the counter for some period of time before it was refrozen, I think it could affect, I'm guessing it could affect the viability, but, none of it is Elanco supported because, they tell you to just throw out the rest of the vial.
Right. Dr. Jacobson just noted that they were told it won't come on dry ice here in Canada, but does come frozen. You have to be very meticulous about keeping it frozen.
Right. So I don't know if it's still effective. Maybe we're just, maybe the ones who get the vial after we've used it one time are not really getting effective CPMA. That's certainly something we should consider. It's just, we're just trying it. So, doesn't come on dry ice in Canada. So maybe,
Interesting.
I'm certainly not an expert on any of this kind of stuff. I just, just kind of trying things out, but.
Sounds good. There was a question that came in about dosing. Were you
Yeah.
going to speak to that?
Oh, sure. So we use the same dose as dogs, which I think is 0.2 mils per kg, if I remember correctly, but it's the stated dose. We're using the same in cats, and we're giving it subcutaneously.
Right.
So there are 2 doses now. So we're using the treatment dose. There's a new dose that was released, as many of you may be aware recently, for exposed but not symptomatic patients, which I think is half the treatment dose. So I think it's like 0.1 mils per kg, if I remember correctly. But yes, exactly the same. For treatment, at least, we're using exactly the same dose as dogs.
Okay. And then another question, that the significant differences you saw between the groups were ones that would have received a refrozen dose?
Some of them, sure.
Yeah, probably.
Yeah. And I don't have a way to track like which ones.
Sure.
That would be great to, thinking back, like, oh, we should have paid attention to which ones were new, but we didn't. And, we have continued this year to treat panleukopenia, thankfully less than last year. And I feel like our outcomes are still quite good. They weren't bad before. I haven't looked at treatment days this year to compare, year on year. But we've been using the same protocol since we started. And so, yes, theoretically, some of those animals in that CPMA group would have gotten not a fresh bottle. Basically.
Okay. There's a few comments rather than questions that you're welcome to peruse through at your leisure.
Okay. Yeah, I see Dr. Jacobson's comment. Look at, yeah. Sure. Yeah, absolutely. And I recognize that like me looking at this data I was looking for different. I wasn't looking at, really I was interested in analyzing our use of CPMA because certainly it's important, it's expensive. But I was more worried about in-house transmission of Panleuk, which is why I started this, and then we kind of realized we had sort of cool. So yeah, I agree. I should definitely go back and reorganize things. The cost per vial, that's a great question. It's expensive. It's $200 something. I think it was $230 when it first came out, but it might be a little higher now. I feel like it's gone up it goes up all the time, all medications.
Right.
You guys are not able to get it yet. Is that I see here, correct? Like in Canada?
Yeah, as I understand it, we're at a sort of a conditional approval phase, so not readily available through our local distributors.
Okay, yeah. So this question, how big are the vials? How many kittens can be treated with one vial? So it depends, of course, on the size of the kitten. The vials treat about 11 pounds. So, so it depends on the size of the kitten, but if you have 8-week-old kittens, you could treat a litter with one vial. And we do use it in dogs so we've used it both for treatment and prevention in dogs, although until recently there wasn't a lower prevention dose. We were using it at the same dose in both. And so if a litter had, 1 positive dog or 2 positive dogs, we would, as long as we had the vials, we would give it to all the dogs. And it's been similar. I didn't have a lot of data for dogs because thankfully we treat about no more than 15 per year. So we had fewer to look at. But we feel like it's been useful. I don't know that I would say it's probably similar to cats and that it hasn't really affected mortality. There are some who will get quite sick and die pretty quickly or come in already quite sick and, very little we can do. But yeah, I mean, it's so I see the question about about an adult dog. Yeah, so an adult dog would be expensive. So we had one recently who was 50 or 60 pounds, and we didn't have enough. And so he got somewhere between the treatment and the prevention dose. I thought, well, it's better than nothing. But also he didn't get very sick, thankfully. So, he had some mild clinical signs, and I don't know if it was CPMA or just the exposure dose. It's hard to say. But yes, it's quite expensive. But also, treating for parvo is really an expensive proposition if you think about your staff time. So, all right, so so Dr. Jacobson, thanks for the question. So CPMA blocks the parvovirus from affecting tissue is the idea. So if it's already, because it binds the parvovirus, and it's an antibody. So if the animal has already been affected for a number of days, then the virus has already attacked many tissues. It's not necessarily going to be as effective as it could be in more of a preventative, as a vaccination would work. So it's similar in some ways to hyperimmune serum, that you're just giving a bunch of antibodies, but these are just specific antibodies. So it will continue to bind virus as long as it's in the body, which is quite a period of time. What do they say, 15 weeks? Something like that. It's quite a long time. And I wish I could remember that very well, but it is recommended and something we added to a medical waiver for when an animal is adopted to indicate that they had been given CPMA. And so their veterinarian may choose to add a vaccination to their schedule in order to help ensure they're covered as an older animal, so that they're not, because it would prevent the vaccination from allowing their body to make their own antibodies. As they and that's also I suppose why it doesn't necessarily prevent shedding, but it binds the virus as it is shed, would be my guess. It was presented to me as that the CPMA would prevent the shedding of the virus potentially, but we're not going to get a positive snap. The virus is bound to antibody, and it won't be infectious as well. So it does, I guess, prevent spread in that way to some extent. Reduces the amount that's available to then infect another animal. So hopefully that helps a little bit, Dr. Jacobson. I don't know if they have more. Prevention dose, yes. So this question, if there's a prevention dose that's available for non-clinical animals, is that used in conjunction with modified live? Well, on intake, I don't know. It's a good question. I mean, I would still give the modified live vaccine because I would be concerned about other diseases as well. So when I get the distemper protection on board. But if we're just talking about parvo, then the CPMA might be more effective because it's already an antibody and the body doesn't have to make it. And so we have that short incubation period. It might be more effective, but thankfully I haven't had to make that choice. I would probably just give a vaccine anyway, although certainly we would be concerned that it might not be effective for parvo if we're also using CPMA. Most of the animals that I give it to are already in-house and so have been vaccinated and now are receiving CPMA several days later. But yeah, I mean, I would still want to prevent, we have a good amount of distemper down here in the States. I don't know if that's a problem up in Canada as well, but.
Lucy, there's a question. Do you redose the CPMA?
You're not meant to redose. At least that's the way I understand it. And it's never, it's not recommended in anything I've seen so far to redose. So it stays for a surprisingly long time. I mean, it's surprising to me in the body. And so we just give the one dose and then then we'll continue with vaccination with the combined distemper parvo, but plan to give an extra distemper parvo. I think it's 15 weeks if I remember correctly. But I know there's guidance specifically from Elanco about that, so that you can plan it out for the adopter, or as the shelter, you can plan it out. I don't know if I missed any questions. Thanks for.
Yeah, no, it looks like we covered them. We could do a last call out for questions for sure. Yeah, looks like that's it. Oh, hold on.
Yeah, so we keep using it. Yes, we gave it to the dog that I mentioned recently. I do sometimes wonder for adult dogs, is it worth it? Because certainly for kittens, I can treat a whole litter with one bottle, but for an adult dog, it's a lot. And often, not always, often adult dogs are maybe a little more immune. I guess you could hedge your bets and use what are the immunity, the antibody check, if you trust those, and see if they have antibodies, and then make your decision there. It's usually young dogs we're dealing with, and so often I feel that they're either already clinically affected pretty significantly, or they're beginning to get there, and so I assume that their immunity is not much. It's pretty small. But yeah, for adult dogs, I feel like it's more of a question mark. And maybe for adult cats as well, especially if you feel like, again, that they may have some immunity that's already there. So for those, I'll say, we probably will, because we tend to be cautious as a organization, and we can generally afford it. But if it were going to, if it came up that we were spending a lot of money on it and we needed to cut back, then I would probably first look at cutting back on maybe checking antibody levels with the point of care tests that are available, potentially. And then making a decision on the older animals that don't seem clinically affected. But I'm happy with how it's working. And we're planning to publish. It would be nice if I have time. Is that?
That is always the
Okay.
rate limiting step.
Yeah, I need an assistant. I need Dr. Jacobson to write it for me. That's what I need. Yeah, I do. Yes, or Brian. Yes.
Jay's wondering if you know if other in the US are adopting the protocol in the same way. I know that you've been out kind of spreading the word.
Right. So a lot of people are interested. And I think most people have the same questions just across the board. Is this really worth it? And I've definitely heard from some folks who struggle with just a basic medical budget that it's out of their, it's not possible for them, and they'll continue what they're doing. But I do think a number of folks were considering it. So I don't know if I've heard, I think Jen, oh my gosh, why can't I think of her last name? She's in Colorado, Boulder Valley. I think maybe they're doing it, because that's who I talked to about using it in the beginning. But yeah, I don't have numbers. Actually, Brian, speaking of, he might know more, because he's sort of collecting data for Elanco, so he may have a better idea. Yeah, I feel like some people still euthanize, obviously, and smaller shelters who, again, struggle with providing basic medical care to the animals are probably going to euthanize, and I support that decision for them, because I feel like that makes the most sense. in their situation. So, South Carolina, just to provide some context, 75% of the shelters in the state do not have a veterinarian in any capacity. And so those are shelters that are generally not treating for things like Panleuk and Parvo. So that's a lot, and that's consistent across the South. I don't know exactly all the percentages for the states, but in the Southeast, at least, that's pretty consistent. Most shelters are operating with no veterinary professional. But yeah, I'd love to know what other people are doing, especially because I feel like Canada's a question mark for me. I don't know much about sheltering there.
I can speak to what we do at Edmonton Humane. So we don't see a lot of parvo, particularly. I would say we're between 5 to 10 cases a year for parvo here, but much more for Panleuk. So I would say, we have 50 or so cases a year. And we actively treat both. Moving to IV fluids as needed, but we do definitely use both in-house and we have fosters that inadvertently have become Panleuk households because of the timeline between litters. So we do both, but oftentimes in-house and just supportive care.
Okay.
And occasionally we will move to euthanasia for the ones that have a poor short-term prognosis.
Sure.
But happy to see what other organizations are doing. If you want to pop it in the chat, that would be interesting. Or not. It's possible that we don't have a lot of shelter attendance.
Lots of typing, I'm sure.
Or lots of typing, yeah. We need the bouncing ball. Okay, so in BC, in British Columbia, parvo is treated generally, but Panleuk is not. Euthanasia is still the default.
Sure.
And Rachel, would that be for all age groups, like adult cats as well? If you're okay to respond. I think a lot of organizations who have the ability to treat also have the luxury of isolation spaces that are so it comes with
Right.
a footprint that allows that to happen.
Of course, yeah. So for us, we ended up getting a construction trailer, the type that's often used for the office for the construction site. And we just put that behind our shelter. And certainly that also costs money. So I'm not, immune to that fact, but we had nowhere to treat them. And we were using, corners and our euthanasia room, which was not ideal for many reasons. And so that has been sort of a mission for years for me and for, the rest of the medical team to have like actual isolation space for these. So now we have that, and that's worked pretty well. And it didn't involve building anything. Yeah.
Yeah, so SPCA indicated that age matters not, but that they don't see a high case volume. And Dr. Jacobson was wondering if for those that don't treat, is the main issue the treatment itself or the risk of transmission, or kind of a little 50-50 between both of those.
I think for us, before we started treating, it was certainly risk of transmission, but also just capacity to provide the actual treatment. So I guess that would mean treatment itself, but isolation space and staff time, because we just did not have staff who were trained. I didn't have a registered technician or a licensed technician. And so it would have been me doing it, which is not always, a reason to not do it, but also when you have, 30, 50 cats coming in a day, it can be overwhelming. And I know I can't deal with this today. So for us, at least, that was, and when we were able to, get a handle on our animal flow and have slightly fewer and some more skilled, labor, then it became a little more of a possible.
Right. And a question again in the chat, just if anyone is doing outpatient Panleuk treatment. And I can say again for Edmonton Humane, if we diagnose in foster and they're clinically stable of sorts, it's just, rip roaring diarrhea that we need to support, then yeah, we send them back to foster and outpatient them for sure, as long as the foster is informed and is on board.
And we are the same. I love it when the fosters will keep them if they're stable, as you say, because it means we have to do less.
Absolutely.
Yeah, and we'll see them every day. So, and we do sometimes, especially kittens on intake who are quite unwell or, or really recent intakes and progress quite quickly, we will euthanize those. It's not, we don't treat everything. So it sounds like a lot of similar protocols. Same with parvo dogs. Certainly we get some, especially from animal control, who are found, and by the time they're found lying on the side of the road, they're pretty far down the dehydration shock path.
Right.
So those tend to have poor outcomes anyway.
Very interesting. I have to say this is a record number of questions that we have. We don't usually have this many questions on the platform, which is fantastic. It's a topic of interest for sure, so I appreciate
It's
it.
great. And I'm sorry, I'm not as sure about the amount of time that the antibody binds the virus. I really should know that better off the top of my head, but I know it. I know the information is easily available from Elanco. So
I was going to say most of us are kind of avid learners, so it would be like Googling it as soon as this is done.
I bet someone's already looked it up.
Yeah.
I would be doing that if I were not trying to pay attention. Yeah, it's true. Yeah, it's great to be an active and avid learner.
Well, if that's it for questions, we might give everyone 15 minutes or so back in their day. Let's do sort of a last call out. I have my video back on.
If it's okay, I'll just put my email here in the chat, and you guys can email me if you have something, spring to mind.
Fantastic.
I'm happy to talk about it. And it's just this, this is just what we do, with some support from the literature, but mostly just, what we all do. We try to like save lives and not spend too much money and learn new things. So I think we're all
Well, I think it's
just
very brave, like in a culture, I mean, especially up here in Canada, there's some thought that if you're not offering gold standard or if you're just trying something that you might not be offering the level of medicine. And I appreciate and respect that that you're exploring this and sharing the information. Absolutely. It's brave.
sure. Yeah.
Well, we can wish everyone a happy Halloween. I hope it's a fun weekend for everyone. And we'll catch you next go around. Once again, thank you very much, Dr. Fuller, for
Thanks,
your
everyone.
time.
Appreciate it.
And take care. Bye.